Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you for the scientific committee for inviting us to talk about this important topic. My topic will be about establishment of reference intervals for free light chains and immunoglobulins in Saudi population. As you know, that the patients with multiple myeloma are characterized by the clonal secretion of plasma cells. And these monoclonal immunoglobulins can be used as an indicator of abnormal proliferation. When the monoclonal light chains becomes too small to be detected by serum protein electrophoresis, then it will be difficult. To be quantified. So therefore, sensitive nephelometric assay is important to be there to measure the free kappa, free lambda light chains. For this assay, it's important to evaluate the reference intervals for free light chains in healthy individuals. The first publications which was used as a reference interval for free light chains was in 2002 by Kutzman in the United States. And these reference intervals are actually used as an indicator for the presence of monoclonality and warrant further investigation for the patients. The current screening algorithm recommended by the International Myeloma Working Group actually utilizing these values in their guidelines alongside the serum protein electrophoresis and IFE. To establish reference interval for free light chains and other immunoglobulins, IgG, IgM, and IgA, in adult Saudi population, we used the protocol adapted from the global reference interval from the International Federation of Clinical Chemistry. Since 2015, we established the reference interval for clinical chemistry parameters for about 25 clinical chemistry parameters and for about 25 immunoassay parameters as well in 2020. And recently in 2023, we established reference interval for hematological parameters in Saudi populations. It's important to establish reference intervals for your populations because these reference intervals are different from one population to another population. Therefore, for free light chains, we recruited about 200 healthy individuals. 55% of them were female, and all subjects were adult less than or more than 18 years. And they were recruited from 3 different regions, Riyadh, Jeddah, and Hassan. Exclusion criteria was existing or pre-existing or suspected unidentified monoclonal gammopathy, and also disease like diabetes, recent infection, inflammation, renal dysfunction, liver disease, pregnancy, anemia, or any other hematological disorders. Ethical approval was obtained from King Abdullah International Medical Research Center. We did blood samples to test immunoglobulins, free light chains, CBC, renal functions, liver functions, bone profile, and lipids on all subjects. And testing for free light chains and immunoglobulins were performed using Optolite auto analyzers based on the nephelometry principle. Subgrouping would depend on the standard deviation ratio, and also we use ANOVA to categorize our groups according to the age. And we use the parametric data analysis, which is 90% confidence interval, to calculate the reference intervals in our Saudi population. The results shows that there is a regression analysis shows that there is a correlation between the free kappa, free lambda, free light chain ratios and immunoglobulin A with the age. And also there is a correlation with the IgG, the smoking, and we found a correlation between IgM and the sex. Standard deviation ratio, which is important to consider for categorization or reference interval partitioning, we found that IgM is the only parameter which need to be partitioned according to the sex. This is the most important slides, which we summarize our reference interval for the Saudi population. So if you have the OptiLight analyzer or free light kits, then you can use this reference interval. As you can see, the free light chains, Kappa and lambda and free light chains ratio, reference interval are in yellow color. Sorry, in yellow highlight color. This also, you can see the distribution of our subjects' data for free light chains. For the free light chains, as you can see, the last figure over there, the free light chains ratio increased with age, as expected. And also, you can see the IgM there, the difference between the male and females is big, actually, and significant. This box plot distribution shows you the current manufacturer reference interval, how they are different from our established reference intervals in Saudi populations. As you can see, the big difference, and you can see the outliers according to the subject's type. We have normal or healthy subjects, and we recruited hypergammaglobulinemia subjects, and we recruited hypogammaglobulinemia subjects, but without monoclonal gammopathies. So you can see the outliers in the top of the figure, how those outliers are clear with the using of manufacturer reference intervals. This is also to show you the difference between different populations. You can see the free Kappa, the Saudi is in the green line, how the Saudi free Kappa is bigger or extended in values compared to the other countries and compared to the manufacturer, which is the Kitzman's publication. Also, you can see the free Kappa lambda, the lower figure, you can see the free Kappa lambda different reference interval, which is going to the higher side compared to the other reference interval.
1 minute.
Also, in conclusion, locally derived reference interval for free light chains and immunoglobulins analytes specific for Saudis are established, and after careful consideration for other various factors such as sex and age, these reference intervals, we are confident about it because they are more reliable than those provided as a guidance from the manufacturer and from other countries, and that will help the clinicians for appropriate classifications of patients and prediction of disease and management for Saudi population. Our acknowledgement to Saudi Society for Clinical Chemistry and also for King Abdullah International Medical Research Center and also for the support from Binding Site Company. Thank you so much.